Hello, Rachel. It is so nice to have you here. I am joined by Rachel Honeyman, who is actually a former student. Is it okay that I tell people the story? I taught many years ago in a school in Miami, and Rachel was one of my students, and I've kind of followed her trajectory through life. I guess you could say via Facebook or social media, and have learned and watched your own life, your experience, and admire you more and more every day. So thank you for being here.
Thank you for having me, and thank you for saying that. That's so nice, and it's definitely like a nice little blast from the past to be having this conversation. So yeah.
It really is. Yeah, before I became a therapist, I was a teacher, and honestly, that's part of what like pushed me into becoming a social worker was I began to realize that I was involved with a lot of the more social needs of my students, the emotional wellness and health of the students. And at some point my husband was like, "Why don't you just get a degree because you're doing it anyways?" So that's what happened. After I taught, I was like, "Time to go back to school," and got my master's in social work. Okay, why don't you introduce yourself to us? Tell us who you are, where do you live, and tell us a little bit about your story.
Sure. So I am Rachel Honeyman. I live in Long Island, New York, with my husband. His name is Svi Daron, and we've been here for we've bounced around. We were in Miami, and then in back in New York, and then back in Miami, and then back in New York. So we've bounced around, but we live in a really wonderful community in Oceanside. And we've been married for we just had our 13th wedding anniversary. And we've been together for 15 years, which is crazy.
Wow.
Um, and we actually have a pretty different story than most, I would say. When we got married, we actually had no plans to have children. That was kind of just something that both of us, I guess long story short is we both have a lot of childhood trauma, and we just kind of both had come to that decision of like, this isn't really what we want. We both came from large families, and it just wasn't kind of what we wanted together. So it actually worked out well that we met, and especially in the Orthodox world, that's very uncommon. Um, about I would say about 6 years into our marriage, my feelings started to change, as happens as we get older, and things kind of change, and I think that happens in many areas of life. But it's certainly common in this area, and I just started kind of feeling like, you know what, I think that maybe I want to reconsider this, that plan. And we started discussing it together, and came to kind of the decision to pursue parenthood. Took a couple of years before we actually took action, but we decided to take that step. Um, and we had an inkling very early on in making this decision. My husband had some odd blood work stuff, and we had an inkling that there may be an issue from a fertility standpoint. We didn't get confirmation of that until after I had removed my IUD, and we, had started the process of actually trying to have a child. But we found out, I mean, within months of making that decision, we knew that my husband has non-obstructive azoospermia, which is, the fancy way of saying he was not producing sperm. Um,
Let's just explain a little bit more about that from a medical perspective. When we say non-obstructive versus obstructive, do you want to explain the difference between the two?
Yeah, and my husband is a doctor, so he would probably do a better job of explaining the the medical side of it than I will. But I think anyone who goes through fertility treatments, you become a quasi doctor. So,
Absolutely.
so basically, issues with the sperm, azoospermia means no sperm in the semen, and that can be caused by either something obstructing that from coming out, or it could be caused by an unknown reason, or there are other reasons as well. There are some genetic issues that could cause that to happen. my husband basically, he was, everything was clean as a whistle. He had no reason that we could find that caused this to happen, but he, for whatever reason, probably this was something that he was born with and just never knew about until, it became an issue. But for whatever reason, he had no sperm in his semen. And so what we were told is he basically had, the only option that we had would be to do what's called a TESE, and I can't remember what that stands for. You
Oh, I
probably.
have no recollection of exactly what it stands for, but you can
Okay.
I know what it is, and you can
Yeah.
explain it, but
Um,
yeah,
where they basically surgically go into the
correct.
testicle and see if they can extract sperm.
Right.
And we were told that,
Typically, just to clarify, I think they're taking out a sample of tissue, and then
yes.
underneath a microscope, they're actually going slide by slide, trying to just find one viable sperm. It's pretty remarkable what they can find, because really, like we say, really only just need one good one. But it could take hours and hours to go through slide by slide to try to identify if there's any kind of viable sperm available at all.
Yeah, and we were told, our doctor said there's a 50-50 chance. There could be nothing in there, there could be a few, like, we just have no
Right.
idea. Um, and we got actually very lucky that when they did the surgery, I mean, it did take them hours and hours and hours to sift through the tissue, but they actually found thousands of sperm, which, just to put it in context, like compared to a regular situation where there should be millions of sperm,
Hmm.
there were thousands. So very, very small sample size, but enough that we actually came away with 5 vials of sperm.
Wow. That's
Uh,
interesting. Hmm.
five, actually six vials of sperm.
Hmm.
Um, much more than we anticipated.
Sure.
And basically our only path to having a child that was ours biologically would have been IVF.
Right.
That's the only way um to create a
To like
child.
use those sperm. Exactly.
Yeah,
Right.
exactly.
Exactly.
Many people, have asked me, well, why didn't you just take that sperm and do IUI? When you have such a small sample size, it's just not possible. It's
Correct.
not.
Correct. And typically within an IVF procedure, what we're talking about is actually it's something called ICSI, which is where they're injecting just one sperm into one viable egg with the hopes of creating a healthy embryo. So, it depends on how much sperm they have. Sometimes they'll almost like wash the egg with those sperm to try to get one to swim in properly. But when you have such a limited quantity and we don't know about the value or the quality of that sperm, that's not how they're going to waste it, because you also cannot do many or multiple repeat TESE procedures because it messes up with hormone levels in men and testosterone levels. So it's something that we're a lot more limited. It's not like, oh, we'll just do another procedure next month and get a couple thousand more. Yeah.
Correct. Yeah, it was not an option for us to do this again. We had what we had. And in our case, with every round of IVF, and I'll talk about kind of that in a minute, but every round of IVF, we wound up having just enough sperm after hours of sifting through each vial, just enough sperm for the eggs that we retrieved from
Mm.
each round of IVF. So we're talking about very, very, very few sperm. So they had to use ICSI to inject a single sperm into a single egg.
Okay. So tell us what happens after this. This sounds hopeful at this point, right? We have the sperm, we have availability. What happens next?
Yeah. So I had gone through before my husband had his surgery, and he had to have a surgery 1 year in advance of his TESE. He had this is what happens, right? They always find additional issues. And so they found something totally unrelated to the fertility stuff, and he had to have a surgery, and he needed a full year to recover before
Mm.
doing the TESE. So in that kind of interim window, I froze my eggs. I went through a round to freeze my eggs so that they would be ready to, when we did the TESE, if there was any sperm, they would defrost my eggs and do the the whole putting them together. I'm blanking on what
Right,
it's called,
right.
and I'm now years away from it. So,
Yeah. Yeah. Isn't
um,
it it's amazing also how the brain, like, kinda shuts down parts of that story. It's like the
yeah,
things that were very, very, sharp and on the edge of your tongue every day talking about this experience, and then as time passes, it quiets and you can't hear that anymore,
yeah,
and you
it's so
forget.
true. It's so
Yeah.
true. It was like it occupied every minute of every day for so long.
Right. Right.
But yeah, so when he right after he had his surgery, he was in recovery, and they're, trying to fertilize the eggs. And they were able to create, here's where I like don't remember all the details. They were able to create, I believe, two or three embryos, maybe.
Okay.
Um, and from day one. And then, as anyone who's gone through IVF knows, that it's with each day, you're losing more, some embryos, most
Potentially.
embryos do not make
Right.
it to
Correct.
that level of maturation that's needed to create a viable embryo. And we were able to create, we came away with one embryo from that round of IVF. We did genetic testing. We had, just given everything that was going on, we just wanted to be really sure before doing a transfer. I felt like it was going to be more traumatic to do a transfer and then, possibly either miscarry or find out that the baby, was not
Wasn't well.
healthy.
Right. Right.
So we did genetic testing. That one
To
embryo
clarify that, right, to clarify that's genetic testing of the embryo
of the
to make it.
embryo, correct.
Mhm. Yeah.
And we got the unfortunate news, that one embryo was not viable.
Mm.
And so that was devastating because as you said, we had all this hope, and for us to, have only created one embryo that, wasn't healthy, it just felt like such a blow.
Sure.
Um, so we decided to do another round of IVF. We did actually take some time in between because it was just very emotionally taxing. Um, and I won't go into as many details with each round because no one wants to hear those, those boring details. But basically, the second round, we had the same situation, except that we actually created three embryos, that made it to that day 5 potential viability. But when we did genetic testing on the embryos, all three were found to
Oh,
be
wow.
not viable.
Mhm.
Um, the third round, which was actually pretty shortly after the second round, um, my doctor called me the day after my egg retrieval, and the way that they do it is the day of the egg retrieval, they defrost a vial of sperm. They see if they can find enough to
To
fertilize,
fertilize. Mhm.
as many eggs as we got. Um, and so then it's just a waiting game. So he called me the day after this and said, these embryos are not looking good. One of them is looking a little bit better than the others. I think that our best shot is going to be to transfer it. So let's not wait until day 5. Let's transfer it. And it may have a better shot at survival in its natural environment.
Mm.
Um, and so that was a big decision, even to do that.
Sure.
Um, and I had to make a decision, like, he said, you either come in an hour or like, we're not doing this.
Wow.
So, so I decided, you know what, we're going to do this. We're going to give this a shot. And I went and we did the transfer, and I was shocked that 2 weeks later, I actually had a positive pregnancy test.
Mm.
Why was I shocked? Because I was bleeding the entire time. So I was like, there's no way. I mean, there's no way. I'm not pregnant. There's no way. And they said, that can sometimes happen. The nurse was not concerned. She said, that can sometimes happen. It's not a problem. But by the time I went for my next blood test a few days later, um, it showed that I had had a chemical pregnancy. So a chemical pregnancy is basically, it's basically just a very, very early stage miscarriage.
Right.
Um, Most people who are not going through IVF never know that they're pregnant at this point because it's
Right.
so early on that, most drugstore pregnancy tests wouldn't pick it up even,
Right.
so it's really something that probably only people going through these types of treatments are even aware that they're going through. But that was a very, very traumatic experience for me.
Sure.
I mean, I actually wrote a piece about this experience because I found out on Purim of that year about having the miscarriage. I basically knew that that was what was happening, and I got the news as soon as I got home from Megillah reading.
Mm, yeah. Can I
Yeah.
ask you, when you say that it was traumatic, can you help others understand what that emotional experience is like when you say it was traumatic? I think it's important for people to hear what the actual on the ground non-medical experience is like for you.
Yeah, I mean, it was basically like um, part of this whole experience, and I think anyone going through this experiences this to some degree, but our experience especially was like this dash of hope followed by dashed hopes, right? And this was like I just at this point I just assumed like I'm not going to be pregnant. It's not even possible. So to get that positive pregnancy test and feel like, oh, maybe this is actually going to work this time. Like maybe this is going to work. And then to find out that just it didn't happen. Felt like it felt like a piece of me was ripped out. That's
Yeah.
basically how it felt. And it felt, and I will tell you very honestly, like that experience permanently changed me. I am never the same. I will never be the same person because of that experience. And that may sound crazy to someone who's like, you were pregnant for all of, 5 minutes. Like it was like a few cells. Like this was the potential child that my husband and I had worked so hard to to and that got crushed. And so it's an experience that is hard to fully capture, but it was a permanent change for me.
Thank you. I think it's important that the validity is offered, the validation of these kind of chemical pregnancies of a chemical pregnancy is offered here, because I think that it's so often dismissed as like, yeah, but it wasn't, but it didn't become, but next time. And I think what you express is the much more honest experience for people who are going through this.
Yeah. Yeah. Um, so at this point, we only had, I don't remember if it was 2 vials of sperm. We had 3 vials of sperm left. And I basically at this point, I was like, I don't know if I can go on. I really don't know if I can go on. I don't know if I can do this again. Um, and so we started discussing at this point the possibility of using donor sperm. We had, good reason to believe that the sperm was the problem. And so we felt like, I felt like, well, if we use donor sperm, then I can go through IUI, which is a much less traumatic, physically traumatic. I don't know that it's less emotionally traumatic because it's still, you're putting a lot of hope into something that may not come to fruition, but at least physically traumatic. And I really did, some people weather the hormones of IVF great. I did not. It was a nightmare. So
Right. And even for
um
IUI, you would still be using hormones, but they would have, or they're trying to do a natural cycle at this point. Natural being non-hormonally invasive versus more of a prep cycle or a stimulation or like a stimulation cycle with medication.
Yeah, so my doctor, because I had told him, and he's a wonderful, wonderful man, Richard Grazi at Genesis Fertility in Brooklyn. Um, he he felt very strongly because of my reactions to the hormones. He was like, if we do an IUI cycle, we are doing it naturally. We're not going to do hormones. We're going to try to do it naturally.
Hmm.
Um, so that was the kind of where we were. We never actually got to the point of getting donor sperm because Tzvi, my husband, was really not so into this idea. He really had a hard time with it. He really felt like, well, we have 3 vials of my sperm. Like, why would we not try again with that? Like, I feel like he felt like he had this possibility to still have, a child that was his genetically, and um, he really could not kind of wrap his head around the idea of using
Hmm.
donor sperm.
Before I move on, I
So
just want to ask you one question, and feel free to say I don't want to discuss it, but there's a lot of halachic conversations around the use of donor sperm, a little bit more halachically complicated perhaps than using donor egg. I'm wondering if that's something you're willing to share of what that process was for you in terms of making the decision within the construct of halacha about using a donor.
yeah. So we did, I mean, every step of the way we asked questions that we felt we needed to ask. Some people have more halachic or rabbinic involvement at various points than others. But certainly when it came to donor sperm, we felt like we needed to ask the question. And so what we were told, and different people have different opinions on this, but what we were told was that it had to be non-Jewish sperm,
Mhm.
which is complicated actually. The sperm banks don't necessarily identify, if someone is halachically Jewish, or, like, how are you going
Right,
to know?
right.
So what we were told is basically that we could kind of go based on what they revealed to the bank. So if someone listed that they were Jewish, like, that was off the table. And that was what we were told.
Okay. Okay.
Um, sure. So then this is like, I want to say it was probably a full year after that third round of IVF that resulted in the chemical pregnancy, that I finally said, you know what, let's try one more time, with Tzvi's sperm. Let's try it one more time. And my doctor decided to try a completely different protocol at this point. He's like, all right, let's not like try to do the same thing over and over again. Let's try a completely different protocol. The different protocol had me on hormones for much, much longer. I believe it was 5 or 6 weeks in total. It was different hormones than I'd been on before, but it did a number on me. It was really,
Okay,
really
you gotta explain for people what that means, because we talk about the Clomid crazy, right? But obviously, we're talking about injectables. We're talking about a much higher level of intensive hormonal treatment. Tell
right.
people what that actually means.
Yeah, and I've never been on Clomid because we never got to that point, so I can't really talk about that. But it basically, so I had a lot of physical symptoms from
Mm,
the medications. Not everyone has that, but one of the side effects that I had from this particular the particular drug that I was on for a very long time, and I can't remember what it was. I think it was Lupron. I believe it was Lupron. Was joint pain, like
oh,
awful, awful joint pain. Like my whole body hurt. And I actually still am dealing with low back pain that started then. Is it for sure from that? Maybe not. It might be emotional. I don't know, but it started at that point, and like, how many years later I'm still dealing with that. So that was one, just the physical, and and then obviously, you're bloated, and you feel like your body just feels, um, I felt like almost like an out of body experience where, like, I'm like, this is not my body. This is not how I'm supposed to feel. Um, And then emotionally, it's just like that feeling of not being in control of my emotions at all. Like it's just this roller coaster. I could burst into tears at any point. I was set off by a lot of things. I had a lot of anger and rage and, and outbursts and things like that. So it just was a lot of, um, physically,
Chaos.
emotionally,
Yeah.
it's just
Chaos.
physical and emotional
Right.
chaos.
I,
Yeah.
I do want to, I think this is a great opportunity for you to share with the audience what you do, at least what I've seen you do from a professional perspective. I'm not sure exactly what you're doing right now, but I want you to talk about, just take a minute and tell us of what you do from your martial arts perspective, if you call it martial arts. Tell us a little bit
I
about
do.
who that, because when you talk about your body and owning your body and body feeling not like yourself, this, I would imagine this was an even greater implication for somebody like you.
Yeah. My real job is I do branding and marketing and building websites. That's my real job.
Right.
But I also in my personal life, I'm a purple belt in Brazilian Jiu-Jitsu. I've been doing martial arts for over 8 years. And I teach women self-defense. And I'm very, very passionate about it. And yeah, every time I did a round of IVF, I had to take time off of my training. Both, basically right when the cycle started, I had to stop, and then usually for about a month after my retrieval, I had to stop. So, that's a lot of time for, someone who I probably on average spend about 6 to 8 hours a week training. And
Sure.
so to feel like I'm not, I wasn't able to do that, was like an added layer. I train for many reasons. One is to feel strong and powerful and, in control of my body. There's definitely an emotional aspect of my training. I think probably anyone who exercises knows that it is
Absolutely.
very, very
Right.
beneficial for mental health. So there was just that added layer of difficulty when I was going through this is like I'm not able to train and I'm feeling totally out of control with my body. And
Yeah.
it always would take time to kind of get back to myself afterwards. And it just felt like you said, like chaotic
Yeah.
constantly.
And I'd imagine that it also like adds almost like insult to injury, that you go through a cycle and now you have to like recondition your body back to health. And it doesn't mean that, and the result is not, oh, but at least I have a baby out of this. Like, or at least we got healthy embryos out of this. Like the results don't feel like they're making it worth it. And to go through this again and again to decondition and recondition your body from a physical perspective has to have had an implication. It has to have had an impact. Yeah.
Yeah. Yeah,
Yeah.
absolutely, absolutely. It was a a very difficult thing to deal with, for
Yeah.
sure.
I
Um,
absolutely loved watching videos of you train, totally like in
Mhm.
awe of the strength and the movement. And it's just absolutely fascinating to watch this. I'd never heard of it before, this Brazilian Jiu Jitsu. And I love that you're able to kind of put that out there in the world. It's really a fascinating skill.
Thank you,
Fascinating.
thank you. Um, yeah, so this 4th round of IVF, I'm on these medications for an eternity. Um, and we wound up, I'm trying to remember the sequence of events, but basically once I had my egg retrieval, um, I believe they wound up getting the fewest eggs from that round. Um, and I just to back up a little bit, with each round of IVF, I got a nice amount of eggs. I was young when we started this. I believe when we started our first round, I was 29, something like that. Many women going through IVF are, in their upper 30s or 40s, and it's a different experience. I always got, at least 10, 12. I think maybe even I had one round where I got more. I think this last round, the 4th round, I got maybe 8, something like that. Still a decent amount of eggs for, for the average IVF cycle. Um, and I don't remember how many embryos we got from that round. But either way, they were not healthy. We had the same result again, which is I don't remember if it was one embryo or two embryos that made it to that day 5. But we had the same results from the genetic test, which is these are not viable embryos. At that point, I basically said, enough is enough. I'm not doing this again. I'm not putting my body through this again. My mental health really took a toll. Really, I was not in a good place. I have struggled with depression and anxiety for basically my whole life, and this really kicked that into high gear. And I was feeling, I mean, at this point, it wasn't quite the grief from this built over time. So this wasn't even the peak of my the depressive episode that I entered. But I really was not in a good place. So I said, you know what, we're not doing this again. But what I was willing to consider was, because again, Svi was like, we still have 2 vials of sperm. Like, I don't want to give up hope on this. I said, okay, so let's use donor eggs. Oh, actually, hold on. I just remembered there was a step in between. We got a call from our doctor a few months after that 4th round. And he said, the genetic testing lab that tests the embryos just came out with a new test, where they can actually identify where the issue is coming from. Is it coming from the sperm or from the egg? Can we go ahead and test the samples that they still have? I said, sure, let's find out. I was sure that it was going to be an issue with the sperm, because that was what all signs were pointing to. And they still had samples from, I think, 3 embryos, and all of the issues were coming from my eggs.
Wow.
Which was quite a blow. It was like,
Sure.
We have this additional layer that it didn't even occur to us that might be an issue. And that really cinched it for me, where I was like, I am not going through another round of IVF. This is ridiculous.
Right. I do
We
want to just take a second from a scientific perspective to clarify when we talk about coming from the egg versus coming from the sperm. So we are not talking about inherited genetic diseases. We're not saying, oh, these embryos were abnormal because there's an inherited dysfunction of the genetics that is coming from the egg, and that's what's creating these abnormal embryos. These are considered chromosomal abnormalities. There's actually another podcast that I have that's coming out with Dr. Erica Schindewolf, who's a geneticist, who talks about that these are chromosomally normal versus chromosomally abnormal embryos. That's not the same thing as genetically normal or abnormal. So what that means is that when they talk about, is it coming from the sperm or the egg, it's this idea that there is something that is kind of turning on or turning off in the development of the embryo, and there's some kind of genetic coding that's causing that to happen, that what the result is a chromosomally abnormal. So then there aren't 36 lined up chromosomes properly in these embryos. That's not the same thing as, because the 2 of you could have gone through genetic testing, come back completely matched and perfectly healthy, and still be creating chromosomally abnormal embryos. Correct on your side?
Thank you for clarifying that. Yeah. And part of this is we went through every genetic test you could imagine. So
further confirms that idea. And that's confusing for people, because they think like, well, if it's PGD tested, then we should be fine. And what we're saying is that PGD testing identifies chromosomally abnormal, but it doesn't identify genetically abnormal embryos unless we know that we're looking for something very specific. But in your case, what's actually happening, which is a little bit unusual, is that they are creating these chromosomes. Something is shutting off the healthy development of an embryo, and we really don't know why.
Right, exactly. And so, and so there's like, now we have more information that it was something wrong happening, that wherever that connection was going wrong, was originating with the egg.
Right.
But we don't know why. That doesn't tell
Right.
us why.
Right.
But it really cinched it for me. I said, I'm not doing another round of IVF. And this was when I said, let's try around with donor eggs and just see. We'll see. So we did a round with donor eggs. We like picked out a donor, and it's a totally different process picking out donor eggs versus donor sperm.
Right.
Uh, they give you, first of all, it's much more expensive.
Mm-hmm.
Sperm is very, very cheap.
Mm-hmm.
And eggs are very, very expensive. And so when you're picking out a donor for eggs, you get a lot more information because, if I'm spending, I believe it was something like $16,000 for the donor egg cycle. I'm spending all this money. I want to know all
Yeah,
the information.
exactly.
So, um, and we got the exact same results. So
Wow.
even though actually, I think they weren't even able to create any embryos. It just didn't, no embryos made it to day 5 even, with this round. So even though we had found out from genetic testing that there's something wrong with my eggs, we don't know what, there's probably still something wrong with the sperm because
Right.
something just isn't working. And at this point, we basically have we've done like the scientific experiment basically of like
Yes.
isolating the eggs and isolating the sperm, and it just something is not working. So we this was a really, really important juncture for us. And I I basically said, and this is like partially a personality thing. Like I think that for some people, maintaining hope is a positive thing. For me, it was actually severely damaging
Mm.
because as I held on to hope, that continued to get crushed. It like pushed me further into this hole of depression that I was in. And I just felt like I can't do it anymore. I can't hold on to that hope. I can't hold on to that at all. So I decided, and obviously with Zvi, we decided enough is enough. We're not going to continue on this road at all. And we had, before kind of coming to that decision, we explored the possibility of doing embryo donation. Um, and we did explore adoption, and we basically came to the same conclusion, which is it doesn't really matter what road you go down. Like there's no guarantee. We've already had this roller coaster over the course of, at this point, it was like 4 or 5 years. And I just did not feel like I could handle more disappointment. And going down any of those roads, that's a possibility. And so we came to this conclusion that parenthood just wasn't going to be in the cards for us.
Yeah. When you experience this as a couple, one of the things I'm thinking about is, were you always on the same page at this point? Were you both on the same page? Or was there time needed and discussion and intervention? Like, what was needed for you to reach this decision? I imagine there are couples where one is very confident in that decision, or like firm in that decision of, and where the other feels like, no, but there's still this possibility.
Yeah, so we were not on the same page. I wouldn't even say that throughout the whole thing. It was kind of, here and there we were, we
Sure.
in the middle, but we were kind of going through our own journeys through this. So, I mentioned earlier that when, some years into our marriage, my feelings about having children changed. Zvi's in some ways didn't. He maintained some level of ambivalence. And still today, if I asked him right now, he would say that he still feels ambivalent. But ambivalent doesn't mean like, I don't want this. It means there's a lot to consider here. And he didn't feel a strong pull in one direction or the other, which left him in this I think it's still a very uncomfortable place to be. We don't like the gray as
Sure.
humans. So
Right.
he I was kind of always the one pushing things forward or put, so at certain points he was pushing forward because he felt like, well, if I'm going to be a parent, I want that child to be mine, genetically and biologically, um, which is something that I think is more common for men to feel than women. And that was something he had a much harder time wrapping his head around raising a child that wasn't his own, and that's, I think a very normal feeling, but it was kind of compounded with that underlying ambivalence that he had. So when I came to this decision, that I could not continue, he, it took him a little bit of time to come to terms with that. And, eventually, the same way I said, what, I'm shutting off the possibility. We're not doing this anymore. We're not continuing down this road. He felt like he needed finality as well. And so he decided, we decided together to actually destroy that final vial of sperm.
Wow. Hmm.
Yeah.
Wow. It's a powerful decision. It's a very powerful decision.
Yeah.
Um,
Yeah. Because you can't go back on it.
no. Mm. Can you tell me a little bit more about what prompted that choice? Because I feel like, people may say, okay, but what about, but maybe, but what if? And I think I want you to speak a little bit more to that idea of finality.
Yeah. Um, obviously we gave it a lot of thought. And I was actually very against it for a long time. I said, no, like, what if something changes? And the more I thought about it, the more I said, you know what, like, we have the information that we have, right? We know that there's something wrong with my eggs. There's something wrong with the sperm. There's never going to be a point in time, as long as I am, of reproductive age, like, there's never going to be a point in time where I say going through another round of IVF is a good idea.
Right.
And in some ways, I felt like there might be a point in time where I say to myself, maybe I'll go through another round of IVF, and it would be a really bad idea. And so I wanted to actually not allow myself to, while I was feeling clear about it, to say, you know what, it would not be good for my mental health. Um, and I'm making that decision now for future Rachel, who might have a moment of, forgetting that this
Hmm.
is a really bad
Hmm.
idea.
Do
And really,
you have, do you have moments where you question today? Or like, and question doesn't mean like I made a bad decision. Question means like, I wonder what if, I wonder if.
um, definitely not when it comes to IVF. I feel I don't think I've had that moment.
Mm,
And this decision we made, I would say it's been about 2.5 years, probably, maybe a little bit longer. Um, and in that time, I don't think that I've ever had a moment of saying, I wonder if I should go through another round of IVF. I have had moments where I say, like, I wonder if I would want to go down the road of actually, like, exploring adoption.
mm, mhm.
Um, that's something that, as long as I'm not single, right? Some people are doing this alone and can make that decision. And I'm in a partnership. And so that's a decision that we would have to make as a partnership. And as long as, Svi's not on board with that, I'm not on board with that. And there's still the overwhelming feeling of opening up that can of worms is, like, I'm not sure that I could actually handle the potential, disappointment and heartbreak and everything that can come along with adoption.
And I think that that's so important to acknowledge that typically these experiences are never perfect decisions, and they're never always confident decisions, that there are times where that thought shows up, the I wonder what, and wondering if I could, and then the coming back to the more grounded reality of what is. And I think learning to live in both of those spaces, like to be able to blend that I always will wonder, but I also am confident, but I'll always wonder, and learning how to create a life with those shared emotions and shared experiences. I think it's
Yeah.
crucial for people to see that.
Yeah, and life is messy. It's
Oh yeah.
messy. Something that I am currently grappling with, and this is again, it's 2 or 2 plus years later, um, is I actually have to figure out what do I want my life to look like now? And I was in such a dark place emotionally for so long um after, the especially after the round with the donor eggs, where that just felt like, we're done. It took me a very long time to get to the point where now I'm like, oh, like I can be a person again, and I can now figure out like what do I want my life to look like? This is not going to be part of my life story. What does it look like now? And it's going to take a lot of work to figure that out.
How do you find the supports, or what kind of supports are in place for you to figure that out? Because I think that that's some of the, like, again, I hear that from people of like, I don't even know where to start. I'm wondering what you found helpful.
Therapy is great.
Yay! Okay, that was a plant. That was a total plant. I agree. Therapy is great.
Yeah, and I have been very, very lucky that I have an incredible therapist who
Good.
has really supported me through most of this. And so, that's I think a huge piece of it. Having a very strong, we have a very strong support system in our friends. We don't necessarily have a very strong support system in family, but we've made our own family that, in the form of friends. And so that is helpful too, is
Yeah.
talking to our friends. And kind of what I have noticed in the last, um I would say in the last 6 to 12 months, is that even most of my friends have their lives figured out, at least from the outside, it looks like they have their lives figured out. They, got married and they had their families. And, now most of my friends, their kids are getting older, and, they're entering this kind of like next stage of life. Um, and I think at some point, everyone grapples with what does my life look like and what do I want it to look like? And life doesn't always revolve around the kids. And
Right.
it's a difficult thing that most people deal with at some point. So in some ways, it's helpful that we didn't kind of go through this early on in our marriage, because now, I'm 36, my husband's 43. Most of our friends are kind of entering that next stage and grappling with a lot of the same questions. And so we're in a lot of ways able to support each other through that.
Right. Tell us a little bit about the things that fill you up. What are the things that just fill you?
Yeah. So martial arts is a big one. um, I am also very active in our community, particularly with one of like my pride and joy is I started a women's Megillah reading here in our community, and so this is our 6th year that we're going to be running that, and we now do a Megillah Root reading, so it's
Beautiful.
very, very special, and something I'm very proud of. And just spending time with friends. Travel is a big one. We were just talking before we started recording. My husband and I just took a big trip, and we love to travel and hike and do lots of outdoorsy stuff. So
Yeah, I
yeah.
would call them sometimes extreme travel. There's no question. I'm watching, I'm like, yeah, I would never do that. But I love and admire watching your ability to do that for sure. Um, okay, so I did want to finish off with two questions for you. One, I wanted to explore for just a moment what it was like as a faith-filled person, right? You've mentioned being Orthodox, you've mentioned being part of the community, the value that your religious practice holds in your life. Can you just share with me a bit about where faith played in to this entire experience for you?
Sure. I think that my answer is probably different from a lot of people in my situation, because it was a real struggle for me. And it's still a struggle for me. My faith in God never wavered. I'm not someone who's like, um, how could God do this to me and angry and, and therefore that has impacted my relationship. I think that it's more, um, I did not find comfort in leaning into that. So, as an example, when people, even while we were going through treatments, if people asked for, our names to daven for us, I found that personally very triggering.
Mm,
I didn't want people davening for us. That wasn't something that I wanted. And certainly now when people ask for that, it feels even more like, I think that I do sometimes actually say to them, you can pray for us to find peace with our current situation, but don't pray for us to have a child because that's not going to happen. I struggled a lot with that idea of like praying for an outcome.
mhm.
That is something that just in general is something that I have a hard time with. So I think that the way that people in our community at large um, deal with these types of issues is maybe didn't quite align with how I needed to approach things. So we don't like to feel like we don't have any control over a situation, and people don't like endings that are not happy, right?
Sure.
So people feel this need to, I want to daven for you. I want to help impact this outcome, which is it's coming from a very nice place, but I think for many of us, it can be very triggering, especially when it feels like I'm doing all the things that I need to do and I'm not getting the outcome that I want. Um, so I personally, as I was going through it, going through everything, I really kind of pulled away from not from my faith and not from my practice, but from the community. I really kind of I couldn't go to shul. I couldn't go to events. I really just needed to not be exposed to that because it felt like at every turn I was faced with that kind of other approach that just wasn't working for me. And it's only been in the last probably year that I've kind of reemerged, we'll say.
What do you wish? I mean, in that moment, I'm wondering, you're telling us what not, please don't say that. And I've heard this before, actually, that idea of like, you don't, I personally feel like I don't need to have your Tehillim name in order to daven for you. Just like if and people say to me, like, give me a list of the clients that you want me to daven. I'm like, no, like I just say, I daven for this client and that client, and Hashem knows exactly who I'm talking about. Right. And
Yeah.
whatever that looks like. But what do you wish in those moments somebody might have said to you? Is there something, or you don't necessarily have to say anything?
Um, I think this is what I always say is if you don't know the person very, very well, find a very close friend of theirs or a family member that they're close to and ask what to do because everyone's different. Some people really do find comfort in people davening for them. And some people, don't find that triggering at all. So what is triggering for me or for some other people is actually has no bearing. I would never say to someone, don't daven for people. Like we
Right.
should
Right.
daven for people. But I think that, if you aren't absolutely sure that this is someone who is going to feel okay with you asking that question, don't ask them. Ask a close friend. You can ask a close friend for their name and they never have to know that you're that you're
Exactly. They don't
davening.
have to know. Exactly.
Yeah.
Exactly.
And the same thing, just like kind of tacked onto this is one of the examples that I've given before is, this happened just a few months ago, or maybe it was probably a year ago. Um, Someone who I know pretty well, but I wouldn't say that we're close, had a baby, and her sister-in-law, who I am very close with, reached out to me and said she really wants to ask you and Svi to be Kvater at her son's bris. Would you, she wanted me to ask you. And I said, I so appreciate her asking you and not asking me directly, because it's not something that I feel comfortable doing. I said no. But I felt much more comfortable saying that to my very good friend than I
Sure.
would have to the person who is out of the goodness of her heart asking me to be Kvater at her son's bris. And that's not
Right.
something that I feel comfortable with.
Right. So, in one last question before I ask you the way that I like to end all of our podcast questions about what are the misconceptions that you wish people understood about fertility struggles. Before I get there, one last comment from you about relationship with your husband. And I'd love to hear from you what you feel if you could speak to couples who are dealing with long-term struggles to have children. Like you said, you're married. You said 15, 13 or 15 years?
13,
13
13
years.
years. We're
13 years
together
together
15.
for 15. Okay. So 13 years. And what do you want people to know are like protective factors or the things that you feel help to really strengthen the relationship between the two of you as you were going through a hard time?
Hmm. Um, this is a little bit of a difficult one for me to answer, because I will tell you very honestly that it took a toll. I think that probably for many people it takes a toll.
Yes.
And it's really only kind of now that we're starting to rebuild and recognize, like, we really let a lot lapse. When we started this journey, so naively we said, oh, this is never going to be the sole focus of our relationship, right? This is a thing that we're doing together, but like, the relationship is the core, and this is just this thing that, it's terrible that we're dealing with it, but it's just a thing. It is so all consuming. Fertility treatments are so all consuming. And um, even now looking back, I wish that I could even think of how we could have avoided that. I don't know. I don't have an
I don't
answer.
know if it's avoidable, right? I
Yeah,
don't know that
I
it's
don't know if
avoidable.
I don't
Mhm.
know if it's avoidable. I think that it's just a matter of recognizing, like, maybe earlier we could have recognized it and made interventions earlier. I mean, thank God we're okay, but it's taking a lot of
Right.
work. The same way that it took me a lot of work to rebuild my mental health. And now I'm kind of in this new reality where I'm saying, what do I want my life to look like? And that's going to be probably a long struggle. It's not something that I'm going to figure out overnight. And it's kind of the same thing with my marriage, where it's like, okay, what do we want this to look like now that is not part of our reality? We
Right.
had built that vision, and it's not happening. So what does that
Right.
look like now?
I think that's accurate. And I think that I think the one thing I would be thinking about as a therapist is this idea of that acknowledgement, if possible, at any way, that to preserve the marriage, to preserve that relationship in whatever way you would normally preserve a friendship and relationship, beginning to pay attention to that because it does take a toll and it's something that needs attention and nurturing and nourishment um especially in the experience of infertility. Okay, top 3 misconceptions that you would like to blow out of the water. What are the things you're thinking about when it comes to fertility?
Ah, okay. Let's see. Let's boil it down.
If
um,
only 2 is also fine.
okay. Well, there's so many.
I know.
I think probably the biggest misconception, especially given our outcome, is that not every story has a happy ending.
Right.
And we need to, a lot of people have this idea. We hear it, anyone who's gone through infertility has heard well, why don't you just
Just
adopt,
do
right?
right. Or
But
just do IVF. I
or
mean, that
just do
one
IVF.
just
That's
yeah.
what I was gonna
Yeah.
say,
Yeah.
that people say, "Well, just do IVF," and they have this idea that you do IVF and you get a baby at the end, like, that's just what happens.
Right.
Um, it does not happen that way for a lot of people. I think that our outcome is unusual. Most people continue until they get the result that they want. But it doesn't happen for everyone. And even in the cases where it does happen eventually, you don't know how much pain and suffering went into making that happen. So that I guess
Absolutely.
is misconception number one.
Okay.
Um, Number two would be similar, but everyone deals with this struggle in a different way and needs different things. So this kind of relates to what we were talking about earlier, which is if you don't know what someone needs and you feel like you want to help them, um, your best bet is going to someone who will know better than you do. The someone who's very close to that person. To a certain extent, there is a need to a little bit walk on eggshells around someone who's going through something like this. Not in a bad way. I think just being really careful, and not saying things that are going to potentially trigger them, even if you have the very best intentions.
Right. Excellent.
Um, I can't think of
We could leave it at two really good ones, two really good ones. And
Okay.
I think in framing what you just said, that idea of like, just because you listen to this podcast or just because you listen to somebody speak about their story does not mean you now know how to interact with 100% of the time with everyone who's been through the struggle to create their family. And I think that that's a valuable kind of misconception to remind ourselves of, that one person's story, one person's experience, but generalize that to, how might I do this differently? How might I be more soft, more sensitive, more careful, you know, and interact with a little bit more grace with those who are in struggle. And I think that it definitely takes a tremendous amount of bravery for you to tell your story, especially when the outcome is not what you had hoped it to be. You don't have that miracle ending story. And to be willing to put that out there, I think takes courage and, of course, vulnerability. It also is something that will help others who have a similar story in some way to yours. And so I just want to thank you for being willing to put it on the table for all of us to learn from and to listen to. And we're cheering you on from wherever we are. I can't wait to see what comes next for you.
Thank you so much.
Thank you, Rachel.